Cancer is a difficult and often scary battle to face, and everyone copes with it differently. Recently, the Duchess of Cambridge was actually diagnosed with cancer, so she's a member of the British royal family, and recent reports have surfaced about her battle with cancer. So in this video today, we are going to unpack what kind of cancer Kate Middleton has. We're going to talk about what cancer actually is. We're going to talk about some facts around cancer. We're going to touch upon cancer prevention and how to generally screen for cancer and cope with it. So if you like this content, then please like and subscribe. If this kind of stuff interests you, I'm a family medicine doctor and I enjoy making these channels. Your support goes a long way. So let's get into the cancer diagnosis part with Kate Middleton. So she had a cancer diagnosis, but she decided to keep the diagnosis private. So that was to protect the family. And then she went on to get preventative chemotherapy after she had the diagnosis made. In the meantime, we found out that she had a operation. So let's dissect some of these aspects and get into the finer details of it. So she had something called a major abdominal surgery. So let's touch upon that for a moment. What is major abdominal surgery? So this is surgery on the abdomen, on the part where generally you're going to find your gastrointestinal tract and your organs within. So right away from that, we can tell that it's unlikely to be a breast cancer, bone cancer, brain or lung. Possibly, but unlikely. Her age also plays a role into it, so the possibilities get narrowed down into perhaps a gastrointestinal or a gynecological. But also there can be spread of the cancers called metastasis, so it can start in one area and end up in another. So that's called primary cancer and secondary cancer, so metastasis. What is cancer actually at the end of the day? What is it? It's an abnormal growth. So it's an abnormal growth of cells. They go wild and then they spread through the body. Normally, cells grow, they divide, and they die in a controlled manner. However, in cancer, this order process goes crazy. So it leads to formation of tumors or the invasion of nearby tissues and organs. So cancer can develop in virtually any part of the body, and it can originate from different types of cells. So this is what cancer is. So it's an abnormal growth that gets unregulated. Your body falters in its method to regulate abnormal cells, and it grows and it grows and it grows and it divides and it infiltrates other areas and it forms tumors, and that's what cancer is effectively. So it can develop anywhere in the body, any type of cell, and really cause problems, and we're going to get into that in a moment. So why do the cells become abnormal? Why do they go crazy? Well, there's generally three aspects to this. So there's a genetic component, so some people are a bit more genetically prone to it. There's an environmental component, and there's also then a lifestyle component. So these three are thought to be a combination of the causes of cancer. So the exact cause is often complex, but it often involves a combination of these three factors. So this is what we are really going to hone in on in this video. So the risk of cancer actually increases with age. This is what we know. But several kinds of cancers have been increasingly seen in younger adults. I mean, Kate is 42 years old. She's on the younger side of cancer patients. But the incidence of cancer has been rising among people under the age of 50. So in the United States alone, for example, colorectal cancer is actually largely to blame for this kind of a thing. It's now the leading cause of cancer, death, in men under the age of 50. And it's only second place to breast cancer in women of the same age. So this is actually according to the most recent annual report from the American Cancer Society. So this trend is likely similar in other Western nations, in the UK in particular. So this is very troublesome, very worrisome statistics that are being thrown in our faces, and we are struggling to cope with it. So the risk of cancer increases with age, but it's rising in the younger populations ever more. So the global incidence of early onset cancer is rising. We've just established that. So it's happening more and more in the younger population. So a recent study in Oncology BMJ, British Medical Journal, indicates that between 1990 and 2019, there has been a rise in the global incidence of early onset cancer by a whopping 79%. That's wild. And also, there's been a rise in the same time frame by cancer death, actually, by 27.7%. Again, crazy, just in this short amount of time. What is going on with that? So that's jarring evidence. Similarly, in the Journal of American Medical Association, it's been noted that between 2010 and 2019, breast cancer accounted for the highest number of cases in the younger population, but gastrointestinal cancers were rising really, really fast. Now, to get even more depressing with these facts, we can dive into it even more. So when it comes to the gastrointestinal cancers alone, they capture the implication. So ultimately, people are getting cancer at a younger age, and more people are getting cancer. And the question is, why? Well, we go back to that complex cause of potentially the mixture of genetics, environmental, and lifestyle. The reason genetics is in red there is because that's the only one we can't control. The other two we can potentially control more so. Now, an even more depressing and damning fact here is that people born in 1990 have over double the risk of getting colon cancer compared to those born in 1950. So that is insane to think about. So there's effectively a quadruple risk of getting rectal cancer, for example. So these are the things we need to be thinking about. So what did Kate do? So Kate is intending to reduce the risk of cancer coming back by doing preventative chemotherapy. So what is that? It's chemotherapy treatment given after the primary treatment. So in the Princess Kate's case, the primary treatment was surgery. So surgery removed the tumor, the abnormal growth, plus potentially some of the surrounding tissue and lymph nodes where there has been a breakaway cell, so an overspill of these cells. And then what you do is you do some chemotherapy to zap those cells that are remaining. It's risky business, but that's the way to do it. That's one of the treatment options. So the question is, why is there an early onset increase, and why is there an increase in early cancer death? Well, it goes back to the genetics, the environmental, and the lifestyle. Most likely the answers are somewhere in these blurred lines here. And our lifestyle plays a huge role in this, nutrition and lifestyle. So we have things that are more pronounced in today's society than they were, let's say, 100 years ago. So this is something to really, really keep track of here. So the population's underlying genetic risks haven't changed in the past several decades, but the environment and the lifestyle has. So they play a greater role. So things like ultra-processed foods, sugary drinks, red meat, smoking, these things play a role. Smoking especially related to the lung, but also other organs as well. Alcohol, there has been sleep alteration, so in terms of stress, obesity, and physical inactivity as well, that sedentary lifestyle. So alone, and especially in concert, altogether as a mixture, these factors can alter the internal processes of our bodies by upsetting metabolism, ratcheting up inflammation, absolutely impacting the gut microbiome. So there's more bacteria there than there are cells in your body. So this is something important. It plays a role in digestion, mental health, immunity. We've made a lot of videos on the gut microbiome and digestive health, so take a look at those videos, please, to learn a bit more there. What is screening? So what is screening for cancer? So it's important to note that the cancer that Kate has, or anybody has, it doesn't discriminate. So it doesn't matter if you're a member of the royal family or anything like that. Cancer will get you at some point potentially. And most of the time it presents as a sign or a symptom. And then you get that and you go to see your doctor, they investigate it, they treat it, they manage it, they diagnose it. But we need to be vigilant to identify these things. So things like weight loss, change in bowel, unexplained pain, unexplained fever. So these are just one of many. Please look online, look at your local guidelines for where you live and see what the red flags are to identify. The other thing to do is to screen for it before these symptoms hopefully happen. So there are different methods of screening. For example, so at a certain age in the UK, for example, you can do a colonoscopy. This looks into the bowel and sees if there's any growths there, because cancer increases with age. The incidence increases with age. You've been more sophisticated recently, you can do a stool test. Women can do mammograms at a certain age to look for breast cancer. You can also do genetic screening if you have a family history of developing cancer. The PSA test, for example, is not a screening tool. We can make a video about that in the future, but these are.